Welcome, everyone. Thank you so much for joining us here today. I know we've got lots to cover, so let's dive right on in. So, hello, bonjour à toutes et à tous. Je m'appelle Jessica Ferne. My name is Jessica Ferne. My pronouns are she and her, and I am the Director of Global Health Impact here at CanWaCH. I am so grateful that we had hundreds of registrants for today's conversation all across Canada and also internationally. So I'm very grateful that you've taken time this afternoon to join us from your homes, wherever that may be. For me, home is Ottawa, where I'm a settler on the traditional lands of the Algonquin people and many other Indigenous nations. Less than 100 days ago, I moved to Ottawa, actually, after more than a dozen years living away. And moving during this particularly challenging period has really reinforced for me how privileged I am to be able to move freely and return to the land where I was born and where my family lives in order to live and work. So I'm very grateful to the guardians of this land who care for it and who have allowed me to learn and listen with them. In terms of our agenda today, I'd like to just quickly share what we'll be talking about. So momentarily, we will have some opening remarks from Dr. Helen Scott, our Chief Executive Officer here at CanWaCH, followed by comments from Global Affairs Canada. Then I'll dive deeply into the report findings, of which there are many. And I'm very grateful that we have two wonderful colleagues here with us, Dr. Boerma and Dr. Brenner, who will share some reflections and dialogue a bit with us, and I'll introduce them in more detail closer to that time. We'll, of course, invite you to give us thoughts and suggestions throughout, and then talk a little bit about what the launch of the report looks like and what next steps will be. So in order to dive right on into that fun stuff, I'll start off by turning it over to you, Helen, to say a few words.
Thank you, Jessica, and welcome to everyone. It's lovely to be here with you today, this afternoon. On behalf of the entire CanWaCH team and our board of directors, I just want to express our gratitude for you joining us and being with us, because we're on this journey together through really what's an unprecedented event. The COVID-19 pandemic has impacted all of our personal lives and our professional lives without questions, as evidenced by the fact that we're connecting with you, most of you, in your homes this afternoon. The pandemic has affected different people, communities, entire industries and sectors in many different and unanticipated ways, and we have a lot to learn from it. At CanWaCH, we knew we needed to understand how the pandemic is impacting our members, their important work that they're doing all around the world, and importantly, how it's impacting the communities in which they work. Fortunately, through the strength of our membership, between March and June of this year, the CanWaCH team connected with more than 100 Canadian organizations and global partners to understand how COVID-19 was impacting their work. We also sought to hear about their concerns and learn about how they're responding in order to document their recommendations. To acquire this information, we wanted to have depth as well as breadth. And you can imagine we can get a lot of information with connecting with over 100 organizations. So in addition to the online survey, we chose to conduct key informant interviews just to do a deeper dive into organizations' priorities, their lessons learned, and their recommendations. We also drew insights from several online dialogues and webinars where organizations were sharing their experiences. So thank you to all of you for that. Today, we're really pleased to share with you what we heard. We're also fortunate today to be joined by leading experts in our sector to offer their reflections on the report's findings and to engage in a dialogue with you on your reflections of the report, on the lessons learned, and how we can look towards the future as we continue this journey together. So before I hand things over to our first guest speaker, I'd like to thank everyone involved in this project from start to finish. So first and foremost, of course, our member organizations. It continuously astounds me the extent to which you support CanWaCH and engage with CanWaCH in the work that we do, and it's always very humbling. So thank you for your generosity of your time. I'd also like to acknowledge the hard work of the CanWaCH staff who conducted the surveys, the research, the interviews, writing, production, design, and more. And to acknowledge Jessica Ferne, our Director of Global Health Impact, who really just undertaken a monstrous project and in quite short turn us around. So thank you, Jessica. And then I'd like to thank Global Affairs Canada for their input into this report and for their continued support of all of our work and that of our members. I apologize for that motor behind me. The joys of working from home. You can't always control all of the elements. One of the key findings of our report is that Global Affairs Canada's response to COVID-19 in the past 100 days has really been a tremendous source of support to the Canadian global health and development organizations. I mean, it's been just impressive to have be able to have the dialogue and the compassion and commitment from Global Affairs to ensuring that we could all deliver on the work that we were doing in the best possible way, both on the ground in communities where we're working, but also here in Canada. And so this is a perfect opportunity to welcome our first speaker. Jean-Bertrand Parenteau is the Director General of the Canadian Partnership for Health and Social Empowerment in the Partnerships for Development Innovation branch at Global Affairs Canada. We're very pleased, Jean-Bertrand, to have you here with us today as an important partner to CanWaCH and to our members. And with that, I'll turn it over to you.
Thanks a lot, Helen. Hello to Julia, to the whole team at CanWaCH. Thanks for the invitation. In particular, my thanks to the Matrix working group led by Jessica. You've done a lot of hard work to prepare this timely report on the first 100 days of the COVID pandemic. You had input from 100 Canadian organizations. Certainly, I think we all know what it is, how it feels, 100 days. I think we've said it, Helen, we've all started to telework probably about 100 days ago. I would like to show you what it looks like 100 days. My family and I have been putting this together. So for every day of the lockdown, the confinement period, we've been adding a ring, and we decided that it's over. We're kind of entering into a different phase. So we'll keep that for the Christmas tree in December, and hopefully we won't have to start a new one. Donc, merci à l'équipe. Une chose que je voudrais souligner dès le début, c'est à quel point les webinaires hebdomadaires organisés par CanSFE ont servi de plateforme vraiment précieuse. On les a suivis de près. Puis en particulier dans les derniers mois, dans cette période de pandémie, je pense que ça a été utile pour tout le monde, pour réunir les partenaires en santé, partager les meilleures pratiques. Ce qui a fait qu'on a pu, je pense, ensemble, continuer à améliorer notre réponse et avoir une réponse beaucoup plus cohérente aussi à la crise. I'd like, of course, to take this opportunity to applaud the Canadian CSO partners who've been working tirelessly since the onset of the pandemic to make sure that your in-country partners have the support they need during these times that are quite challenging. We've been able to safeguard routine health and nutrition services within the broader pandemic response, and this work continues and will be ongoing for the next few months and probably beyond. Something I'd like to mention as well is that I think we all recognize how much the pandemic has the potential to exacerbate inequalities, reverse development gains of the last few years. So it's especially true for the women and children who are already among the world's poorest and most vulnerable. There are additional risks, I think, that emerge as well with the crisis faced by health workers, community volunteers on the front line, providing community health services. So several of your organizations can testify to these challenges and be certain that Global Affairs Canada is following really closely the progress and is quite aware of the challenges you're facing as well.
Important to talk about the challenges and to be more reactive and to have a better responses for the people that were able to interact with the minister, and peut-être you saw the appetite here to have this type of information, and I can assure you that a lot of things have been started So Jessica is going to talk about the report of 100 days in terms of data, information. Ilya.
There are a few things that we noted that are particularly interesting. I don't want to scoop Jessica, but I'll just mention a couple. First, this is really a rich report in relation to all the data issue. There's really a wealth of information in that document. First thing, the weak health information management data systems. That's something we live and we see in Canada, but I think one thing that is made even clearer is how much this is a challenge in contexts like Sub-Saharan Africa and elsewhere in the world. So I think that point is really well made. Still on data as well, I think the case is really well made that it's essential to counter misinformation, and I know a lot of your organizations are active in that space. And also, needless to say, how essential data is to counter rising discrimination among marginalized groups. So be assured we will look carefully at the recommendation of the report. I will have to sneak out of this discussion, so my commitment is to listen to the recording that will be available and read the summary as well. We have, it's Public Service Week this week, and we have a recognition event for our staff, and there's no way I can miss that. I think you can all relate to that. Your teams yourself have been working so hard and in strange conditions in the last 100 days. So, but I'm really grateful for the invitation, and my colleague Tanya for sure will remain online. So with that, I would hand it over back to Jessica.
Merci beaucoup, Jean-Bertrand. I'm so thankful that you could join us for the beginning part of this conversation. All right, so let's dive right on in. I will say I did a dry run of this for myself, and I could not cover all the different elements that we included in the report. So I'm going to do my best to highlight some key moments, key things that emerged, and of course we'll hope that entices you to do a nice deep dive into the rest of the report. So before we go any further, I want to just give you a bit of a sense of why the focus on data. So this came about because, as was mentioned, CanWaCH really wanted to document the lessons that were learned, as they were emerging in response to COVID. So we started having the conversations with members and sector partners. And, this sector responds to global health crises. It's what we do. But as we were talking more about COVID-19 specifically, it became clear that there were some unique challenges emerging that intersected very much with challenges relating to data, monitoring and evaluation, research, technology. And so we decided to give within all the body of great work that's being shared right now, we really wanted to deeply focus on that, the implications, what people are doing to respond and what that means. And then to the question of, okay, well, why 100 days? The title, is meant to, just to clarify, it's meant to denote 100 days from March 11th, which is when the WHO declared COVID-19 to officially be a pandemic. We know that this report is a moment in time. COVID is changing constantly. There are things in this report that are outdated already, simply because of, we put the final finishing touches on it Monday, and it's now Wednesday and things have changed. So the goal here is not to be the most definitive summary of what Canadians have done, but rather to document a process as it unfolds so that we can better understand what we knew, when we knew it, what we did with that information, and what this tells us about going forward. So to clarify, 100 days is officially the case as of this Friday, June 19th. And at that point, we will be making the report and the digital interactive website that goes along with it live and available. So this is kind of your sneak peek, if you will, into some of the things that we'll be talking about. So Helen already told you about how our data was collected and where it came from. More than 102 organizations and many staff from those organizations contributed in a variety of ways to the report. And we decided to structure the report like a timeline, because although March 11th marks that critical moment, there was a buildup, of course, to COVID, to that announcement, and the ways in which we responded to that are also extremely important for understanding where we are as a sector. So we broke the report kind of up into 3 sections. So the first section, and we'll move to the next slide, is kind of the before COVID-19. This is where we had an opportunity to ask organizations the degree to which they themselves were already drawing on lessons learned from past global health crises, if so, which ones, and to what extent. And the brief answer that we heard is yes. In some cases, organizations are drawing from past experiences. They named most commonly Ebola, Zika virus, the broader HIV pandemic were mentioned, as well as a variety of localized infectious illnesses that folks may have dealt with in a particular context. They highlighted that they, in some cases, had created some tools, like survey tools, that they had already established some training programs for staff that they were drawing on and modifying for COVID. But my sense from what we heard actually is that for the most part, the unique elements of COVID made it such that organizations really felt like they were dealing with something new, and that there had to be a lot of creation of new things to respond to the pandemic. We heard a lot about what some of the persistent kind of and common challenges were. But because of the limited time we have, I actually want to move directly into the next slide where we talk about the current reality. So this is the second of 3 parts of the report. So we said, given the lessons learned that you've drawn from, what is it about COVID-19 that's unique, that is distinctly different from what you've seen before? We have about a dozen answers to that. So I'm going to highlight 3 that really jump out at me. One of them is no travel. And this is something that I think really started, for me at least, to shape my understanding of the implications of COVID-19 on data when I heard more and more folks talking about this. The impact on the ability of development organizations to move freely, development organizations and their local partners to move freely, to gather together, to be able to access information that might otherwise be written by hand or stored in local clinics. This has been one of the most defining challenges, and leads to questions around everything from data validity and access to questions about downloading risk to local partners or consultants who maybe are taking or bearing the risk of moving or gathering or adopting some of the data strategies that folks talk about to be able to gather information. We know that a lot of Canadian organizations have shared with us that they have already implemented travel moratoriums for international staff until December 2020, and in some cases into May and June of 2021. This is going to fundamentally change how we talk about monitoring, how we talk about data audits, how we talk about accountability. So this is a really big one, I think, and affects a lot of what we'll talk about. The second one is, questions around domestic engagement. And one of the things that we noticed is that the nature of COVID has meant that a lot of Canadian organizations found themselves increasing their portfolio of domestic work here in Canada in response to COVID-19, with or without a global response. So in some cases, depending on where they generally work or the challenges of their partners, they weren't responding internationally, but they were actually galvanizing to provide support to Canadians. And for some organizations, this was the first time that they had really done that much domestic work or domestic work in this way, as opposed to, let's say, a public engagement type of domestic work. So this has been a major reorientation of focus for some. And then the third one I want to highlight is changing funding partnerships. We did hear from a lot of organizations that they have had very positive, overall positive encounters with funders and donors. That includes Global Affairs Canada, but also others. I heard people talking about seeing some unprecedented flexibility. And they noted specific strategies employed by Global Affairs and others that have demonstrated this commitment to transparency, accessibility, making changes. We document that in the report, and I think it will be well worth exploring what those helpful practices have looked like and what that can mean for how we work with funders later on. Although it's not the main thrust of the report, in the next slide, I want to tell you a little bit about, okay, so what are people doing? As I said, we didn't want to make this the cornerstone of what we talked about because we know that this is constantly changing, but you want to know, in these first 100 days, what are people doing? Well, the top three types of programming that we heard, number one with a bullet was WASH, water and sanitation and hygiene, with a predominant emphasis on communications messaging, prevention of infectious disease, spreading awareness campaigns, etc. Number two focused on what we'd called health system strengthening and healthcare worker training. This is where there was a lot of questions around the availability of personal protective equipment and challenges with supply chain, but a lot of people focusing on that, as well as looking to how they can support local surveillance systems in countries where that's weak. And thirdly was maternal, newborn, and child health programming. And I expect that this reflects the fact that a lot of organizations were trying to quickly pivot their existing programming, a lot of which is MNCH focused, into providing care for families. We did, however, see lots of other programming, and we go into detail in the report about what that includes, but some of those other ones included food security and nutrition, things like care packages, cash or credit programs, economic support, so things like supporting mask making and hand sanitizer production as businesses or economic support to families, and sexual and gender-based violence programs, everything from awareness campaigns to building support centers, programs addressing early and forced marriage, etc., as well as many other programs. Next slide, please. So I'm going to give you just a few numbers that I think are interesting before we get back into the rest of the good data stuff. So when we surveyed folks, 86% of those who responded to us mentioned that they were currently actively responding to COVID-19, and an additional 7% were at that time planning a response. So we knew that there was definitely something that was, this was something that was top of mind and organizations were mobilizing around it. But where's the money coming from to do that work, particularly in the first 100 days? Well, the majority, about 80%, are reallocating or diverting funds from other programs directly to fund it. In the next slide, you'll see we highlight that organizations are responding with in partnership and consortium, and this was a hugely important part of their work. So 85% were working with other organizations, and we counted that organizations were collaborating and could name over 100 different global partners working across 74 countries and 12 regions of the world. And in terms of those countries with the most number of programming, as of when we did this, those were Haiti, Kenya, Ethiopia, Uganda, Tanzania, and then further to the domestic point, Canada as well. We've produced, and the image in this slide is a map, an interactive map on our Project Explorer that we are adding to all the time with the data that you give us about where folks are, and we will continue to add to that with details on the programming as we have it available for your reference. So along with all of this, we invited organizations to tell us a little bit more about what the impacts are on their work. And we generally tried to break it into 4 major categories when it came to data. Those categories are, no, that's the right side. Those are the categories of what's exacerbated or getting worse, what's becoming increasingly irrelevant, what's consistent, and what's changing. So let me highlight a few points here. In terms of what's exacerbated, what's heightened. A couple of things that we heard included organizations noting an increased difficulty in collecting and managing data, particularly primary data, at the same time as they're having to navigate an increased reliance on secondary data, which makes sense. You can't be collecting things in the same way. However, because of these restrictions on travel and the ability to gather together, organizations are saying, for the foreseeable future, our primary data collection methods will be limited. But that doesn't change the fact that in many contexts, secondary data is outdated. It includes rough estimates, or it isn't applicable to the communities that are most at risk and that I'm trying to reach. So this is going to be an increasing challenge. There's also very little data on COVID-19 caseloads specifically in many contexts, and that creates its own challenge. Next, we have what's irrelevant, and I use irrelevant quite, in this context to kind of say what's changed so radically that we have to completely rethink it. And one of the things we heard, especially from our academic colleagues, was a lot of their existing research agendas and programming agendas. And that's not to say that those needs haven't changed. It's to say that a lot of these programs and research agendas relied on let's say mixed method data collection process or certain types of access that is no longer available. So these need to be very much rethought. At the same time as we see that, people often talk about what the other side of this pandemic will look like, or the new normal, or lots of other terms. But we know that COVID-19 has already irrevocably influenced the health-seeking behaviors in the communities where we work, their perceptions of health services, et cetera. So we really need to ensure that any new research agendas or programming agendas draw directly from local and grassroots organizations to help set those revised agendas and priorities in the current context. Next, what's consistent? So no surprise to anyone here on this call, COVID-19 is not the only crisis. One of the words I heard used in the report or from folks was the domino effect. And what's unique about COVID is how immediately we are seeing this domino effect. I think that is maybe in part because in many places of the world, precautionary measures have taken place at maybe different times than you might have thought, or before outbreaks of illness came to that particular context, which affects lots of different elements of people's health, whether it is, things relating to rising poverty rates, food insecurity, rising rates of sexual and gender-based violence, rising issues or concerns around other infectious diseases when vaccine schedules are interrupted, et cetera. And this really has highlighted for Canadian organizations the fact that good data, good M&E systems, these are needed before a crisis. As much as organizations are trying to ramp up right now and supply their partners with the tools and resources that they need, the fact is you can't do that in the middle of a crisis, not meaningfully. So this reminds us yet again that we need to be investing in these systems before a crisis hits, and we need to learn that lesson and not relearn it every time. And then the last piece in this section has to do with, okay, what's emerging? And we heard a lot about this idea of increased comfort with ambiguity, the need to get comfortable with ambiguity as being important. And by ambiguity, I mean, there's a lot of things that we can't know for sure and certain right now, but we don't want that to lead us to inaction either. But what we also heard actually from organizations is not just that we need this, but in fact that they themselves are starting to feel a bit more comfortable with ambiguity, but that they want to see, better guidance and strategy around risk mitigation, how to get more comfortable with using approximates or triangulation measures, using multiple sources of data, doing factor analysis, all while recognizing that going forward, it is going to be very difficult to maintain any sort of methodological consistency in our evaluation. So what does this mean? Looking forward, what does it mean? We have in this next section and the last section of the report, the beyond 100 days, we know that there will be a legacy of the impacts of COVID-19. Organizations were generally united in the agreement that we have to think creatively, but also concretely. And we broke up some of what they shared with us into these 4 categories. Questions about what should our priorities be? What are the challenges that we face? What major questions have come up for you? So what could we do differently? And what recommendations or specific things do you need to make that happen? I'm going to give you some top highlights again, and I look forward to hearing in our discussion what other ones you jump out to you, and where we might dive a bit more deeply into those. But here's my final reflections on that. So one of them, and this one was very loud and clear, was organizations uniformly calling on a maintenance of Canada's focus to the health and rights of women, girls in their communities, with a particular focus on sexual and reproductive health and rights. Major concerns were raised about backsliding on critical gains that have been made in these areas, particularly neglected areas. And it was very interesting to me to see this repeated again and again as a primary concern. So we wanted to capture that, as well as an investment in health system strengthening more broadly. We heard concerns about the possibility that a crisis like this can lead to a regression to outcome measure or to output related measures, and focusing on health outcomes, perhaps to the exclusion of measuring issues like empowerment, as challenging as that is, and adopting rights-based approaches. And so really calling for us to think critically about that and not jeopardize the gains that have been made. One thing we heard consistently is that we know this, we struggle with sex, gender, and age disaggregated data. This is well documented, and it's terrible that this is still an issue. But we heard from organizations that even though we still struggle with sex and age disaggregated data, we can't let that stop us from going beyond it, particularly looking to see how we can be more inclusive in our data, with issues regarding race, disability, income, geography, and a lot more, and bringing that intersectional training and lens to our data as Canadian organizations. A really interesting one for us, of course, also is to think about what it means to kind of harness and resource, so fund, an innovation mindset when it comes to data. One of our respondents talked about how crises can have kind of revolutionary potential and, necessity, the mother of invention and all that, but opportunities cut both ways. And we need to increase targeted funding for thinking innovatively, leveraging technology and other strategies around data and programming. One that I think people will be very interested to talk about, I know I certainly am, is this question of rethinking performance measurement models and doing more with less. This gets into that idea of, as we spoke about earlier, about the challenges of collecting data in this context. A lot of respondents asked us, can we start to interrogate more what constitutes rigor? When is good enough a thing? And when do we need that really scientific approach? And are those always the same contexts? Can we mine the data that we already have, recode it, relook at it, see how we can get more mileage out of what we've already got? And how do we change our measurement models to reflect that? Some final pieces that I think are key are just again coming back to this element of the digital. The fact that digital literacy and data literacy are things that we must continue to invest in the development sector. People talked about modeling, social media analysis, digital and data visualization, feminist analysis, data sharing, all these kinds of questions about how we can better use technology and the training and tools we need. We talked about telling purposeful stories, and this gets into the way that we communicate what we're doing, but it also has a lot to do with straight up qualitative data. How do we make sure that qualitative data isn't just a nice to have, but in fact is critical to how we understand what we're doing? How do we work that into our measurement models and frameworks? In a way that makes sense? How do we mobilize evidence for action and achieve the results that we have there? And can we really ask ourselves tough questions about why we are trying to aggregate in many contexts, and if in fact aggregation is the goal, or if impact is the goal in another way. And then this question of do no harm and the principles of do no harm speak broadly to questions around data ethics. There was a lot of talk about the need in the sector for training and protocols on confidentiality and consent, particularly in digital and distant contexts, ethical dissemination, community engagement, research ethics in community contexts, data privacy, lots of other issues that we need and want to explore. So that, in a very, very large nutshell, is the report. In the next slide, you'll see when it launches on Friday, we will encourage you to visit the dozens and dozens and dozens of resources, toolkits, slides, websites, protocols that organizations have shared with us, and we'll invite you to add to them, as well as to share the timeline widely. And then, although we've said it already on this very final slide, I just want to say thank you to those 102 contributing organizations and the many staff at them who helped us to get where we are in thinking about this. I'm now going to turn it over to our two colleagues to share some insights that they have and reactions and thoughts that they have. And I'd like to begin, if I may, with Dr. Tees Boerma. Tees is a professor and Canada Research Chair for Population and Global Health at the University of Manitoba, the director of Countdown to 2030 for Reproductive, Maternal, Newborn, and Child Health. And he's also, I believe, the director of the Department of Information, Evidence, and Research at the WHO, and has had a lot of experience working in public health and research programs at district and national levels. Tees, over to you for your thoughts and comments.
Well, thank you, Jessica, and congratulations to CanWaCH and the team for this very interesting survey that you managed to complete in this very difficult period with an over 50% response rate. So congratulations to those online. I just wanted to highlight two issues from the report. One is around the lesson learned, and one is around these persistent data challenges that you already addressed a little bit. So the first one, I think we forget too quickly. And so I was very happy to see in the report that there was attention for Ebola response, HIV, Zika, and that a lot of the organizations have that in their mind when they are now dealing with COVID-19. I just wanted to take you back to 2014, 2015. Sierra Leone, Liberia, and Guinea had a massive Ebola epidemic. 11,000 people died in a country with 20 million people in the three countries combined. So in Canada, that would be about 20,000 deaths. And we're now at 8,000 for COVID. And so it had an enormous impact on the countries. And the avenues through which RMNCH and sexual and reproductive health can be affected through Ebola has many parallels with COVID. First of all, there is the supply issue, the closing of health facilities, the faltering supply chain, the health worker absence, and that can have a major impact. It's only beginning now. Demand factors is the second one, a reduction in service use, fear of using services. We've seen it in Canada a lot, everywhere. Third, the diversion of resources to the epidemic response from regular programs, from our own programs. And you mentioned that also in the report. Or in general, a decline in resources for health because the economies are suffering. Fourth is then the decline in the socioeconomic situation that one sees affecting the social determinants of health, poverty, nutritional problems, and we must work to mitigate those. And then lastly, the increased risk of adverse behaviors. intimate partner violence, self-harm, gender issues. I think those are 5 lessons that they all came very strongly in the Ebola epidemic forward. HIV has other issues. Just a bit of good news, I guess, is, the 3 West African countries were heavily affected by Ebola. The RMNCH indicators, we don't know what really happened during the epidemic. But they were star performers before it happened until 2013, particularly Sierra Leone and Liberia. And now the surveys in 2018-19 show that they're again excellent performers. So I think the lessons on what was done in those countries are important. My second point is around the persistent data challenges. So you mentioned 5 in the report as a sort of top issues that came up from the survey. And the question is, have they been exacerbated by COVID-19? And also, what can we do about it? So the first one that came up was limited health data. We have major gaps. We rely too much on national surveys. We have too little local information, etc. And I think that's true. And it's highly unlikely that, in this period, we'll be able to address those gaps because there are structural issues. I think that, there is a lot in national surveys and the kind of data that has been collected that still can be used in the SRHR or RMNCH programming. But that, where we're really struggling, and I'll come back to that, is how do we document the dramatic changes now? National surveys have stopped, local surveys have stopped. We won't have them for a while. The DHIS too, the facility-based data collection is going on. I've seen some reports and I wasn't too worried yet, but we also have a feeling that, particularly in Africa, the biggest impact is still ahead of us. But that kind of information, of course, is very critical. Second, the M&E technical capacity deficits was listed as a persistent data challenge. Of course, critical in all of our work is the country capacity, in this case for M&E. And in the countdown, we really focus on strengthening local institutions, public health institutions, schools of public health, and so on. But of course, it also applies at the district level, etc., where the projects are. And these gaps are more exposed now. But work goes on. And I think from my interactions with countries, actually people take ownership of some of these issues as well. So maybe we can have some positive effects from this, and we can support that through our digital means. And as Jessica said, there's tons of tools and so on. So there are ways to support this technically while country institutions take a lead. The third point was around data gaps on vulnerable groups, equity, gender issues. Difficult to measure. We're never really happy that, we know that no one is left behind, but it's even more serious now. And I think the NGO networks are absolutely critical to generate such information about who's affected most by COVID, direct or indirect. And the challenge is to get from the individual level stories to a public health issue. But to me, this is a priority area for the future, because you can, through innovative approaches, by working together, you can generate information that I think is going to be very impactful. The fourth one is the resistance to data sharing and publishing. Governments, NGOs, academics, and COVID is not helping here. I mean, much distrust. Some countries are not even reporting anything. No one trusts each other's data. So I think we're in a difficult position. And if you think about, what kind of data would I like to have first to sort of at least know where the epidemic is going? I think it's the hospital data. Are there people with severe acute respiratory illness? And then take it from there. And obviously one would really like to know also the mortality data, because it's an objective issue, and not just for COVID, but for everything. But that is a challenge that we still haven't addressed very well. Lastly, the limited interest and funding for data evaluation and implementation research was mentioned as a persistent challenge. I think there are major investment in COVID, shifting of resources, so likely a negative impact. And there will be this huge gap post-COVID, whenever that is, because all the data collection has stopped. And so we really need to catch up there. So we, at this point, advocate for a catch-up, strengthening the country institutions and what they're doing. And some are, still doing field work, I'm sure you are aware. And focus our agenda on the emerging themes, but not forgetting the existing agenda, because we were not done at all. So to conclude, I think this is a great effort. The network that CanWaCH presents of the NGOs, the collaboratives, which I didn't mention, but that's really about, how can we be smarter with the data? And perhaps this is also a good time to reflect on the baseline, midline, endline survey and facility survey methodology. Is it really the best? Is it really giving us the most relevant information for our programs and for the countries? So innovations, I think, are, can grow out of a network like this. So I'll stop there. Thank you very much for the opportunity.
Thank you, Thies. That was great, and lots more I want to ask you about some of the things that you've said. But next, I want to invite Dr. Jen Brenner. She is a pediatrician and clinical associate professor at Cummings School of Medicine at the University of Calgary. She's also the director for the Mama na Mtoto initiative in rural Tanzania, and is a longstanding member of the CanWaCH Metrics Working Group. So thank you so much for joining us here today, Jen. Over to you.
Thanks, Jessica. Thanks especially for the really great report. I enjoyed a lot of the thoughts and insights from the organizations represented. I think it's really a testament to the strength of Canadian organizations that there was so much flexibility, creativity, and commitment in a very short time under difficult circumstances that really come through in this report. So I hope everyone will take the time to read it. I'm going to highlight just a couple of things from the report, and then I want to make kind of a sort of a call for action that I think reflects not only the report, but also what I've seen happening here in Canada. And so just to comment that I think it's important to really, obviously this has been the pandemic's been a huge tragedy, but there really are, I think, some key silver linings here, and that we need to be opportunistic and jump on those. And so just to kind of echo some of the points that were made in your presentation and also in Thies's presentation, I think that COVID-19 has really emphasized for us the importance of having strong government health systems, and data obviously falls into that range. And I think particularly with data, we've really understood in Canada and around the world the importance of a cohesive, integrated system that is not a whole bunch of little parallel pieces in different areas doing different things, but a strong system that exists all the way from the community level right through to the national level. So just to re-emphasize for all of us as we're doing programming, capacity building, kind of that unification, and that every little gap matters. And so I saw that really coming through in the report, and we've seen that here in Canada as well. So investment in that is key. I think also looking at having or emphasizing data systems that depend on local capacity and that are adaptable was really brought to the forefront. And I think the local investment, the local capacity piece has really shone through in a lot of our partnerships and around the world. People have really taken ownership of data in a way that I don't know if I've seen before. And a lot of places where data systems were strengthening, really, there have been big successes in this. I've seen this firsthand in East Africa, where I think in a lot of ways our East African colleagues and teams were much more prepared to do contact tracing and surveillance. They had good systems in place because of their experiences with Ebola and other infectious diseases, having networks of community health workers that you can call on, having systems in place. It's about making those systems adaptable, where I think there's a real opportunity. Of course, we can't forget about maternal child health and sexual reproductive health and rights reporting. That's been raised. I think documenting unintended consequences for us as people who have an opportunity to tell stories is really key, both the success stories and the challenges that have emerged. because of lockdown, because of stigma, because of changing of resources. And I think we really need to bring those to the attention of policymakers, because we do expect a second wave. We do expect future emerging diseases. And so we need to learn from those experiences and showcase those challenges and opportunities. And then the final thing from the report is really around digital platforms. And I think COVID-19 has really forced us, because of travel bans, et cetera, to think about different ways to do business. And many of these can stay with us and will. And now thinking about not only how to collect data, but also how to disseminate data, even in some of the most remote communities now. And I don't think it's exclusive to Canada. I've seen even with our networks around the world, we've really been able to capitalize on some of the different platforms and social media to do data dissemination. So that's been very exciting. And then I guess my, kind of one of the really big opportunities I see that has opened up because of COVID. And I think to me, this is like a window that we should be looking at as CanWaCH and our group of people all working collaboratively in the sector. And that's around this new data literacy that I believe is being generated around the world. I think because people are talking about COVID-19, and this applies at all levels, and I think in all countries too, people are talking about data. People who are decision makers, people who are politicians, and even the general public are talking about concepts around health and public health and health data that I've never seen before. Any of us who have tried to interest people in numbers related to epidemiology in the past, or explaining how disease outbreaks work, or global health, we can really relate to the fact that people actually they may not always know the terminology that we use, but people are really coming around to some of these concepts in global and public health metrics, health equity, and accountability. And I'm wondering if we can build on that to better make the case for an investment in health systems and in health data. And if this is the opportunity we have. Like sometimes in health promotion, we talk about a teachable moment. And I think that could be an opportunity now when people personally relate to why data is important in their personal lives, or why global or public health matters. And so this data literacy, this health literacy is really quite interesting to me, and I'm hoping we could build on that. So if you think about just day-to-day life, you open your newspaper or your social media feed now, you see health metrics everywhere, whether it's the number of cases, comments about mortality rate, or business and political leaders talking about, hospitalization rates. They're even sometimes citing gender and race disaggregated data. Even in, our school kids coming through understand flattening the curve, and these concepts like R naught, and what PPE is. And these are kind of conversations that were not on the radar 100 days ago. So I think similarly, even the concept of global health was probably of limited interest or understanding to so many people, especially here in Canada, who didn't understand how health can impact us. What happens globally really matters. And even the concept of public health. I would be surprised if there were very many people who even knew what a medical officer of health was 100 days ago, and now most people would know Theresa Tam at a glance. So I think some of these are unique opportunities, even to, as far as understanding, and maybe there's a little bit of momentum around the concepts of equity. People understanding that there is an interconnectedness of disease. And I hear people talking about pockets of disease, and this is, it's all over the media. It's our decision makers, it's our politicians who are emphasizing that factory workers, migrant workers, homeless, people in prison, or people with chronic illness, that, they have a different risk, and we need to be supporting them. And because for a lot of people, it affects them. So I'm wondering if our sector can take this teachable moment and build on some of these topical conversations, and then flip that conversation a bit more to the global perspective, and make sure that we're sharing our data and making the case for an investment now in global health and in health for marginalized people and in data while we have this window.
Thank you, Jen. And I think that that's a fantastic, kind of call to action and for forward kind of thinking. One of the things that we want to do, of course, as I've said a few times, is we want to know, okay, so what does this mean for an organization like CanWaCH, right? Like what are our obligations, and how can we best support our members and the broader sector in a lot of these areas that folks are talking about. I'm sharing here, and it should be live on your screen for folks, a quick poll. There's actually two questions, so one in English and one in French. You have to scroll down a little bit to see it. But we would love to get your thoughts and reactions. Looking forward, what of these elements do you want to hear more about? Are we looking at issues of data literacy and digital literacy, community-led approaches? Which of these things do you want to have us hear a little bit more about? And which things would you like to see us, make sure that we address for you? If something is not there, that we have talked about today but haven't yet mentioned, write it in the chat, put it down, and we'll be sure to make sure that we call these out as particular action areas for ourselves going forward. I want to just close by talking about what's next. So there are three things that we will ask you to do in addition to taking your vote on the polls, which I see you are, and I'll share that momentarily. But on Friday, on June 19th, we will be releasing the report. If you are here at this webinar, you're going to get an email with the links to the timeline and to the full report. Please read it. Please share it with your colleagues. The other thing that we want to do is make sure that we keep the tools and resources as updated as we can. You can do that by sending us your data directly. We have the links here on the screen, and I think we'll post them in the chat momentarily. CanWaCH.ca/addmydata. Is all you've got to click on for some immediate directions on how you can give us additional resources, additional data, and we'll make sure to keep this as a living document. And then finally, if you have other thoughts, you can always reach us at metrics@canwatch.ca. I'm actually just now noticing that these three actions are all listed as number 1, but I think that's a good thing. It rank orders them as all top priorities. So try to do all of these things if you can. Share the details on this on this report. Add your data to make it even more rich, and then. Of course, also give us your feedback and your suggestions on how to do that. We're at our time, and I want to thank all of you for joining us here today. I am grateful to you for taking the time to be here and to listen to what we've shared, to making the report what it is. I am grateful to Global Affairs Canada for their support in this work and in developing this report, to Tees and Jen for their comments and additions, and to all of you again for being here today. So we'll continue to keep this open for just a couple of minutes in case there's additional questions that you want to note. In case you're struggling to answer the poll, you can write your answers in, and I look forward to staying in touch with you in the coming days and weeks ahead. Take very good care of yourselves. All the best to you and your global partners, and we look forward to being in touch soon.